As a first world nation and global superpower, we have state-of-the-art healthcare facilities and treatments. Yet we have a dirty secret. The US is the costliest, most dangerous place in the developed world to give birth. A contributing factor to this is the inability to detect fetal acidosis, essentially a baby suffocating in the womb during delivery. This can happen for a number of reasons and affects about 1 out of 10 babies. My name is Tammy Dorsey. I'm a biomedical engineer and a Master of Innovation Design student. I'm also the mother to 5, and this is my son. I've lived this nightmare. Doctors had no idea he was in distress. His heart rate tracing was normal the entire delivery. Now, thankfully, he's okay today, but I've talked to many whose stories were different. This is why we exist, and why I'm passionate to solve this problem, to make sure that this doesn't happen to you or anyone else. Prenatal Hope has developed a non-invasive diagnostic solution that will tell doctors in real time if and when intervention is needed. This will save and improve lives. By reducing unnecessary procedures, we're going to give both mom and baby better outcomes. We're going to reduce doctor liability, and we're going to save insurance companies big money along the way. Now, we've teamed up with industry leaders and the original biosensor engineers of Johnson & Johnson to develop our innovation. Our Vivo 2 is designed as a single patient use device, applicable taking multiple readings per patient as long as mom is in active labor, a few centimeters dilated, and her water ruptured. Now, our competitors are leaving doctors guessing in the delivery room. They're using external monitors that have been in the delivery room for 30 years, and it's not measuring this quantitative data. So our device will give doctors the pH, which will let them know when that baby is in distress. Now, we've talked to doctors, conducted over 100 plus interviews who validated our solution and the unmet need that we can change. Now, our device will also take care of those unnecessary, is the doctor waiting to decide or deciding to wait? Dr. Scrafford said that a lot of times they'll issue a C-section of fearing that the baby is in distress. The baby will be delivered. They'll test afterwards just to find out that baby is okay. So there's a lot of room for improvement. We want to be an augmentation to what's already out there to give doctors the complete picture of how baby is doing. Now, our IP is our own. We have multiple patents filed as well as international protection as well. We've already engaged the FDA, and Sharon Andrews, the lead OBGYN device reviewer, has also verified our novelty, and we're in discussions with fast-track possibilities as the FDA is already aware of the huge unmet need. And we've also engaged, we had a tech scouts from DoD that we pitched to 2 weeks ago that are socializing our tech as the IP platform. So we have a lot of things coming down the pipeline as well. And we're in a unique situation to generate revenue as we seek our FDA clearance, as midwives have emerged as early adopters wanting to pre-order our device to use as an in-home wellness device. Now, our target market is the 4 million babies born in the US each year, and we have NDAs with Cellmark Medical and HealthJib Global to explore global distribution to over 140 countries. Our price points yield healthy profit margins of 65%, and as a single patient use device, we will never reach market saturation. Now, recently, the FDA this last spring has raised the alarm and the need for prenatal care improvement. Hospitals are racing to lower their C-section rates to the World Health Organization's recommendations, and even here in California, there's new legislation and policies going into effect that if the hospitals don't reach those marks, they'll be excluded from their networks. So Prenatal Hope can help. And we are also, not only can we help, but talking to insurance companies, we have an NDA with Blue Cross Blue Shield's venture arm, and they are aware of the situation and what we can do for them. And a 20% reduction, or 6 points alone in those C-section rates, will save insurance companies over $6 billion. Now, my team and advisory board is a diverse multidisciplinary group. Our lead OBGYN has been in practice for over 40 years and is considered a pioneer in fetal acidosis. Our legal, banking, and business have worked together successfully for over 20 years. We have talented assets in engineering, regulatory, and medical. We are in it. We have enough skin and drive to overcome any obstacle. I'm very proud to report that to this point we have been self-funded, and I'm even more proud to announce that as we've opened our friends and family round, we already have a committed $500,000 raise. So we are seeking capital. Thank you. We are seeking capital and those strategic partnerships so that we can lower unnecessary exuberant medical costs to improve women's health care and help deliver healthier babies. Please join us.